I remember clearly like it was yesterday when the legislation was being conceptualized and bringing casinos to Massachusetts. And I think what people underestimate is that we were already a really highly exposed state to gambling.
How many products does the lottery have in Massachusetts? The most profitable per capita lottery in the world, bringing in over $1 billion a year.
To go from that to sports betting is another layer.
Over the last year and a half, we've been bombarded with ads that are deceitful in nature.
You know what to do.
It's basically too easy right now. You can do it even in your phone, and if you have a problem, they're just making it too easy for you to just self-destruct.
People who are preoccupied with gambling, they don't take care of their health, so they're not necessarily going to a yearly medical checkup. They're not necessarily visiting the dentist. They're not necessarily following up on other health conditions, and there is a cumulative effect on people's health.
You know, I didn't know 1 out of 4 people that have problem gambling end up committing suicide. That's more than like drugs and alcohol. This is like serious business.
Most people who gamble without a problem. But we're concerned with the most vulnerable. We have in Massachusetts, as a result of the legislation for the 3 destination casinos, a public health trust fund. So there's an Office of Problem Gambling Services.
When I first came to the Department of Public Health, it was the first time ever that not only did we have the backing of the financial resources to do the work, but to really reimagine this work, right? Most of the work that happens all over the country is on a focus on responsible gambling or promoting individual responsibility. We had a chance to do something different, and that is to think about gambling from a public health perspective. It's about making sure that we create spaces and places for people to bring their authentic selves into a decision-making process, that we avoid the common mistakes that often happen when we're trying to promote equity, thinking that, you know, if we put a person of color on a brochure, that's equity. That is not equity, right? That equity is about really true engagement and inclusion.
One of the initiatives that's funded by the Office of Problem Gambling Services is the Ambassador Initiative. Ambassadors are men of color with a history of substance misuse who are educating their peers and other people in the community about problem gambling with a prevention focus.
The reason I like this job is because I get to talk to people, and after my presentation, I talk to people, and they tell me they never saw the problem that way.
When you say your story first, they get a little bit more open. That's the way I do it. Like that's my little trick to talk to people. I say, oh, I had a problem. You know, my family had a problem. From there I start. If they want to listen more, probably they can talk back to me about it.
We also got a lot of resources, you know, not only for gambling, but for other things, you know, anywhere from housing to getting your license, from doing your resume.
We just give. We give food, we give music, we give awareness.
The best solution for an alcoholic or an addict, the best medicine is to help someone else. Because if I'm helping you, I'm not thinking about myself. The more I just make myself available to people, most of my sponsees have been doing pretty well. And if they're struggling, we talk about it and we work it out. You know, that's the rent I pay for my recovery. You know, there's rent I have to pay to live, there's a car note and car insurance I have to pay to drive. Well, in order for me to stay sober, I have to be of service to other people, and that's the rent I pay for my recovery.
I finally got the respect and trust of my family back. My kids tell me they're proud of me. I haven't heard that in a long time.
The approach has to be one that's grounded in agency, self-determination, and allowing people to make decisions for themselves, and not imposing, because we live in a society where addiction has been treated as a criminal justice issue, as opposed to a public health issue. How well has that worked out?
So one of the amazing projects that we've been able to launch with the help of the Office of Problem Gambling is called AAPI Empowerment Project. You know, many casinos have Asian marketing departments. They have people who speak many different languages. They have everything down in order to make it so easy for someone to be attracted and feel welcome and feel like, you know, kind of like a king. Thinking creatively, one of the things that we've been doing with the support of the Office of Problem Gambling is really providing alternative activities. And they're really just simple. They're just fun activities that, you know, would appeal to Asian immigrants, something maybe they've done back at their home country, something that you can enjoy with other people who speak their language.
因為我哋係考個手機嚟學嘅，每一次嚟呢度考個手機嚟學跳舞嘅，即係冇乜正式老師冇嘅，你中意邊個叻啲就企前面咁咯。
One of the things that can combat isolation is just being connected to more people and people that you become friends with. And then it also sort of gives us the relationship as, you know, people get to know us. You know, if there are experiencing challenges, we have those programs and resources to help them.
但係嚟得呢一度嘅，我哋嘅主要嘅目的就係同呢度每一個參加者去建立關係。關係好咗之後咧，佢自然會將佢心裏面嘅一啲嘅難處同你分享。嗰時候就有機會咧去做一啲嘅輔導或者轉介。
You know, everybody wants to belong, right? And everybody wants to feel welcome. So these kinds of activities really appeal to people.
These kids now, when we were growing up, there wasn't FanDuel, there wasn't DraftKings, there wasn't Pick Your Prize. So now you do have to address this stuff a little bit earlier. When I go into the schools, I don't go there to tell them what to do. Kids are always going to do what we tell them not to do. Just make them aware of the consequences, and then you let them know you make the choice.
Their decision making is purely based on their development at this point. So exposure is a risk factor because what they're identifying is a reward rather than necessarily the long-term consequences. I always say their voices matter, and that's one of the biggest points in our curriculum and our engagement with youth. Like, your voices matter, your experiences matter. Best way to capture is, what do you see?
When we were taking photos for Photo Voice, like, I tried to make sure that everything that I was taking had some kind of meaning behind it.
They have to be given these spaces because unfortunately they're not always believed. They're not always taken as credible. So it's raw footage, right?
I participated in Photo Voice because it made me feel like I could really get my voice out there and, like, you know, have an impact on the community and actually, like, see a change.
Each youth has something different to bring. And so if we want to say your voices matter, we want to make sure they're heard. So if someone speaks low, I'm not going to force them to talk loud. I'm going to get closer. So, like, one of those things of, like, meeting them where they are and then understanding you're seen here and what are the skills we want to develop.
In the Beat the Odds program, we really try to educate youth about mental health, problem gambling, substance use, alcohol misuse. Those are all counterparts, I guess you could say, of mental health and not being able to manage mental wellness for yourself.
Beat the Odds is, like, I would say, like, these group of youth, and, like, we all come together. Like, this year we're talking about problem gambling.
The community, as soon as you go in, everybody's so welcoming and understanding and, like, friendly. Also, what we talk about and the education you get from it, it doesn't only help you with, like, your personal problems or what you're going through personally, but, like, if you see other people, what they're going through, you can also, like, help them as well.
So I do this work because I was born and raised here in Springfield, and now that we have a casino here in the area, I want to make sure that our youth know how to protect themselves, protect their families from going down a road that would be very hard to come back from.
Every program that we have funded through the Department of Public Health has been informed by the community. It's obviously led by data and evidence, but ensuring that we are weaving in the community voice. And that's what I'm most proud of.
Getting real about gambling is not just about the individual. And I think within a society that continues to talk about you, while hiding behind like it's a collective, to get real about gambling is you go to gamble, it's not just affecting you. Someone's seeing you, someone had to pay you, you're losing your money and it's affecting whether it's your home life, it's affecting your children, it's affecting your sister, your mom, it's affecting the way you see the world itself. Your perspective of the world affects the collective. So I think getting real about gambling very much relates to the mission of public health. It's not just about you. You know, we have to think about the collective as a whole. And you going to gamble could be fun today, but may not be fun tomorrow. And how's that gonna affect the way you treat people? How's that gonna affect the way you interact or ask of people.
If you're going to get real about tackling problem gambling, you've got to look at the upstream social determinants of health. Access to stable, affordable housing, good health care, education opportunities, job opportunities, right? And so I think it's really important that we look at those areas to really get at the heart at why recent immigrants, low-income communities really are most at risk for problem gambling.
When we can get real about gambling, then we can get real about solutions. Then we can get real about strategies.
I'm hopeful because we've done research, we've initiated some of these partnerships with the Department of Public Health, and they've all grown. They've all grown in the last 3 years in terms of who we're working with, the numbers of people who are involved, the number of people we're reaching. I was talking with Victor earlier, and the word empowerment I think is really powerful because once you start shining a light on sort of the facts and the issues, that is power. And the facts and issues live within the community. The people know what the impact is, how it's harmed their family. They also know the solutions, right? They also know what's going to help them most. And so when we empower the community, that's very, very strong.
We have to tell people the truth, basically. Right? We have to engage in honest and truthful conversations. The way that we spend resources responsibly is by telling the truth about the impacts of gambling on individuals, families, and entire communities.